The current administration just announced that it is moving forward with plans to impose tariffs on pharmaceutical imports. This move will without a doubt escalate the trade war and pose new threats to millions of Americans who already find the cost of U.S. healthcare to be completely unaffordable. In 2024, the United States imported approximately $214 billion worth of pharmaceutical products, making the United States the largest importer globally. In contrast, exports were around $95 billion, resulting in a significant trade deficit of about $119 billion in pharmaceutical sector alone. By imposing tariffs on these pharmaceuticals, the government puts patients, U.S. consumers, in a position where they will have no choice but to pay even higher prices for prescription, even antibiotics, for example, and of course, over-the-counter medicine. The United States ranked lowest in both accessibility and healthcare outcomes, with 26 million Americans having no insurance whatsoever, and a quarter of the working age population being completely uninsured and therefore unable to afford healthcare procedures. And what you'll have as a result, you'll have people barely surviving, trying to make ends meet as they are unable to pay for their medical appointments and medical procedures. Higher costs due to tariffs may force some generic drug manufacturers to exit the market, especially those that are operating on thin profit margins. And so that reduction in competition will in turn limit consumer choices and allow remaining suppliers to increase prices. The global pharmaceutical supply chain is extremely intricate, with many medications involving components manufactured across various countries. So tariffs can disrupt these supply chains, leading to shortages of certain medications. Tariffs can delay the introduction of generic drugs into the U.S. market, as manufacturers may face increased costs and regulatory hurdles. So without timely access to generics, consumers may have to rely on more expensive, if they can afford them, brand name medications. And as we know, many people simply will not be able to afford those brand names.